Well, good morning. We'll go ahead and get started. As you know, last Wednesday, I was at the White House at the invitation of the President to discuss Iowa's response to COVID-19. Then on Friday, I joined Vice President Pence, Senators Grassley and Ernst when he visited our state to meet with religious leaders and to host a roundtable discussion about the importance of the food supply chain. During that time, we learned that a member of the Vice President's staff tested positive for COVID-19. This weekend, I was notified that the individual was present during my visit to the White House, although I had no direct contact with her. However, out of an abundance of caution, I will follow a modified quarantine plan similar to what Dr. Fauci and other White House administration members have announced that they're doing. As is part of our normal daily routine here at SEOC, my temperature will be taken before entering the building. I'll be tested daily. I was tested this morning and it was negative. And while here, I'll practice social distancing and wear a mask when interacting with others, which will be minimal interaction. If I begin experiencing any symptoms, of course, I will stay home. I spoke with my team over the weekend, and most will be working from home during this time, especially if they or a family member have health conditions that puts them at a higher risk. These steps are similar to what I've asked all Iowans to do if they've had contact with someone known to have the virus. Again, while I didn't have direct contact with the Vice President's staff member, it's important that I do my part to protect those around me while continuing to serve as your governor during this critical time. I want to assure Iowans that I'm healthy and feeling good, and I'm fully focused on leading Iowa's response to the pandemic on our economic recovery efforts. Over the next few days, we may slightly adjust our routine to accommodate the situation, and we'll keep you updated regarding any potential changes. Today, I also wanted to provide an update on the progress we're seeing in key areas of our state and our continued expansion of testing, both through Test Iowa and our targeted strike teams. As you're aware, Eastern Iowa was the first area of our state to be significantly impacted by the virus, especially Lynn and Johnson counties. Over the last 2 weeks, we've seen both counties stabilize and gradually trend downward, which is a good sign that the virus activity is decreasing and becoming more manageable. We've seen similar results in neighboring Washington and Louisa counties, while long-term care and manufacturing facility outbreaks occurred where they did occur. Black Hawk County is a more recent hotspot. It also is showing positive signs of stabilizing. In all of these areas, as virus activity was increasing, we took a proactive measure to mitigate the spread of the virus so we wouldn't overwhelm our healthcare system. And we used targeted testing strategies to better understand how to contain and manage it. We launched our strike teams with Tyson and Columbus Junction, again providing diagnostic and serology testing for every employee. We identified and isolated positive cases, practiced case investigations, helped our employees recover and really provide the reassurance and confidence to return to work in a safe environment while keeping the food supply chain moving. When another outbreak was suspected at the Tyson plant in Waterloo, we sent additional testing supplies to a number of clinics in the area so that they could increase testing in the community, and we worked directly with the plant to test all employees, again, both diagnostic and serology. We also opened a Test Iowa site in Waterloo so residents in surrounding area could also be tested if they had symptoms or had been in contact with someone who had had the virus. To date, we've tested in long-term care facilities about 1,324 staff and residents in about 115 facilities. Through our manufacturing facilities, we've tested over 9,400 employees in 14 facilities and probably another 3,000 this week. Expanding testing in a targeted way such as this helps us confirm how the virus is spreading, and while it drives our positive case count up for the short term, more importantly, it informs us how to effectively manage virus activity for the long term. Positive cases in all these areas are now stabilizing and trending downward. And another sign of progress is that hospitalization rates in the RMCC 5th and 6th region, which cover eastern Iowa, are also stabilizing or trending down, and hospital resources are in good supply. In other parts of the state, we're monitoring an increase in virus activity and we're implementing similar strategies. Just as we've seen at the national level as the virus steadily migrated from the East Coast toward the Midwest, Iowa's virus activity is now increasing in central and western Iowa communities. Polk County has the highest number of positive cases in the state, which is to be expected because the Des Moines metro area has the most concentrated population in our state. And again, we've been conducting long-term care and manufacturing strike teams in the surrounding counties in central Iowa, and increasing testing in the area through Test Iowa. We've also seen some increased activity in the Sioux City area, where we've opened a Test Iowa site and are conducting surveillance testing in long-term care and manufacturing with long-term care and manufacturing strike teams. We've also been monitoring an increase in virus activity in Crawford County, where we opened another Test Iowa site on Saturday and are testing employees again at long-term care facilities, manufacturing facilities, and throughout the community. As anticipated, hospitalizations in RMCC regions 1 and 3 have risen as a result of the increased virus activity in these areas, and again tied to the additional testing that we're performing. So we're working closely with the healthcare systems to monitor resources and assist as needed. And again, we've seen just great collaboration among our healthcare systems, both from a regional perspective and a state perspective. These are some of the conditions and indicators that we're monitoring on a daily basis as we make decisions about how to continue to ease mitigation restrictions and reopen Iowa safely and responsibly. We know that virus activity will exist in our communities until a vaccine is available, but through expanded and targeted testing, case investigation and tracing, and by continuing to take preventive measures to protect our own health and the health of others, I believe that we can and will be able to contain and manage the virus and balance the health of Iowans with the health of our economy. And Iowans continue to respond in amazing ways. Throughout the last several weeks, Iowans have risen to the occasion time and time again to do their part to help those in need. There are so many heartwarming stories, but one that continues to inspire me is how the state that feeds the world has stepped up to make sure that our own aren't going hungry. As demand for food assistance quickly outweighed supply in our food banks and pantries, I created the Feeding Iowa's Task Force, and I asked the Lieutenant Governor to lead that effort. Lieutenant Governor Gregg is joining me today to provide an update. Lieutenant Governor?
Good morning. Thank you, Governor, and thank you for prioritizing food insecurity during the pandemic and assigning me to lead this very important and rewarding effort. I'm proud to give you all an update on the work of the Feeding Iowans Task Force today. The Feeding Iowans Task Force, as a reminder, is made up of leaders from the Iowa Food Bank Association, food pantries, the Iowa Department of Agriculture, Volunteer Iowa, and leaders from numerous state agencies like the Department of Homeland Security and Emergency Management, and the Departments of Human Services and Public Health, and others. We've been focusing on raising the profile of food insecurity issues during the pandemic, and especially helping connect those who may find themselves newly food insecure with the resources that are available to help them. And as a reminder, more information on those resources can be found at www.coronavirus.iowa.gov. We've been also working with to assist the food banks with staffing and logistics support during this time of unprecedented and increased demand. As you know, the governor has assigned the National Guard to assist the food banks, and they've been running daily missions, organizing mass distribution events, packing boxes, and distributing food from the food banks to the food pantries across the state. But the efforts go beyond the National Guard. For example, we have provided new assignments for AmeriCorps workers whose original projects have been canceled or otherwise changed. 311 AmeriCorps members have been reassigned to COVID-19 response, and the vast majority of them are now working in the area of food insecurity at places like the Riverbend Food Bank in Davenport and the Northeast Iowa Food Bank in Waterloo. AmeriCorps members have provided over 8,600 hours of assistance already and have helped package or distribute over 156,000 pounds of food. And next week, we'll begin bringing on at least 70 additional summer AmeriCorps positions to work on recovery efforts with food insecurity all across the state. And we're still recruiting members, so this would be a perfect fit for a college student who has had an internship fall through, or a recent high school or college grad who's looking for something to do. You can visit volunteeririowa.org to apply or to find other volunteer opportunities associated with the Feeding Iowans Task Force. We've also forged a partnership with FFA chapters across the state who are seeking to assist in food-related volunteer assistance. For example, the Charles City FFA chapter participated in a food distribution event in partnership with the Northeast Iowa Food Bank, and we're exploring more exciting opportunities for the future. With supply chain crunches in the news, we've also been working on creative ways to develop our own little mini supply chains focused on feeding those in need. A great example of that is the Pass the Pork initiative, which I thought I'd provide a quick update on today. This is the program in which farmers donate pigs, which are then processed in local lockers, typically in rural Iowa, and the ground pork is donated to the food banks. Through the generosity of Iowans, the Pass the Pork initiative has already exceeded over $100,000 in donations, which helps pay for the processing, storage, and distribution of the pork. We want to say thank you to some of the major donors, including Landis Cooperative, Mid-American Energy, Alliant Energy, Conterra Ag, and the Dahl family of Dahl Distributing. I'm also proud to report that on May 6th, the first 4,280 pounds of pork was delivered to the Food Bank of Iowa, with much more to come. While this is an effort of the Feeding Iowans Task Force, it simply couldn't have happened without the leadership of Secretary Nagg's team at the Iowa Department of Agriculture, and in particular, Deputy Secretary Julie Kinney, who serves on the Feeding Iowans Task Force. I also want to recognize the Iowa Food Bank Association, Iowa Pork, and of course, the incredible generosity of Iowa's pig farmers. So what's next? Well, Governor Reynolds, myself, and the team are analyzing opportunities to further support this work. Resources are available through the CARES Act, FEMA funds, and other resources as well. We're analyzing opportunities to consider expanding and scaling the Pass the Pork initiative and considering including other livestock as well. We're also looking at scaling up existing programs like the Double Up Food Bucks program, which provides a one-to-one match of SNAP dollars to assist in the purchase of fresh produce. And we're looking at other ways where we can create our own mini supply chain, such as exploring ways to break down bulk food items and repackage them in sizes that would be useful to a family in need. We hope to be in a position to provide more information in the coming days and weeks. Thanks again, Governor, for assigning me to lead this initiative, for highlighting this critical work, and for empowering the leaders who've been working with us on the Feeding Iowans Task Force. Thank you.
Thank you, Adam, and thanks to you and to the entire task force for everything that you've done to not only bring awareness to this important issue, but to generate food and funding that will have a positive effect for many Iowa families across the state. So great job, and thank you for all that you and the team are doing. In closing, I want to announce that 2 new Test Iowa sites are opening this week. Today in Davenport at North Park Mall and Wednesday in Ottumwa at Beach Ottumwa. Within 3 weeks, we'll have opened 7 Test Iowa sites, expanded our lab capacity, and tested thousands of more Iowans. Test Iowa is making a positive difference for the health of our state, and we're working hard to optimize our operations so that Iowans have the best possible outcome. Over the weekend, we did have a small number of Iowans who were tested, who were informed that their samples had unfortunately been damaged and couldn't be processed, and that they would need to be retested. While it's not uncommon for a small percentage of samples with any type of test to become damaged, that doesn't make it any less disappointing to those impacted. And so, of course, we want to apologize to those Iowans affected and encourage them to be retested. So again, a reminder to anyone who's interested in being tested at any one of our locations across the state, the first step is to take the assessment at testiowa.com. If you're eligible for testing, you'll be prompted to schedule an appointment online, and you must have a scheduled appointment to be tested. Again, I want to remind Iowans, though, if you're exhibiting any of the symptoms that we've talked about that are related to COVID-19, please call your doctor and they can go through the assessment with you and help you identify whether you need to have an assessment or whether you need to be tested or not. So with that, we will open it up to questions.
First question, Chris at KCCI.
Hi there, Governor. Question about the remdesivir that I was supposed to be getting. When will it be here? Where will it go, and how will it help?
I didn't hear the question. I'm sorry.
remdesivir.
Oh, okay. Well, we got remdesivir. We received it over the weekend. We've actually had 2 conference calls with doctors and pharmacists. The second phone call will be this afternoon, as well as with Dr. Padati and the Department of Public Health team. So they will put the parameters together and agree to what that distribution looks like, and it be based on who benefits the most from the drug. And we want to make sure that when we're administering it, that the physician has been connected with someone that has had experience with the drug. So we received it this weekend. They're working in partnership with doctors and pharmacists. They'll have a second call today, and then they'll make the recommendations on where those tests should be performed, who benefits it most, and to make sure that they have consultation with the doctors that are doing that.
Kay Henderson, Radio Iowa.
Governor, will you allow the public health emergency proclamation currently in place to expire on Friday, or do you plan to have parts of that extended in counties with higher levels of COVID-19 activity?
Yeah, so I'll be making an announcement tomorrow about some of the additional restrictions that will be eased, and then we'll take a look at the overall proclamation that will be extended through the 15th. Well, some of it extended through the end of the month, and then some of it is set to expire on the 15th. So we'll be addressing that tomorrow at the press conference. And again, as we take a look at what's happening across the state, and we're able to use the data and the experiences and the strategies that we put in place to help us inform the decisions that we make moving forward. And again, I want to just say that Iowans have been incredibly responsible. We're seeing that as they're continuing to practice social distancing. I think they're wearing face coverings often when they're not able to practice the social distancing. We are seeing businesses be very thoughtful and cautious about how they start to reopen their business so that they can provide the confidence to, the customers that are going to facilitate or will come to their places of business. So I've been really impressed with not only what our business community has done, our church community has done, as well as just Iowans in general. And so we can continue, I think, to lessen the restrictions and open up our state and start to begin in a very thoughtful, safe, and purposeful way to start to continue to reopen our economy. Excuse me.
Aaron Murphy, Lee News.
Thank you, Governor. I'm just wanted to ask, based on what you know now, do you think that you should have worn a mask during Friday's event? And then more broadly, should more Iowans be wearing masks? I know you said you feel like a lot have. I guess just based on my anecdotal experiences, that number is actually pretty low. And just what is the administration's formal recommendations on wearing masks in public?
Well, there's great guidance that's been provided by the Department of Public Health, so I would stress all Iowans go to the Department of Public Health or coronavirus.iowa.gov. Is it gov? And you can see there where all the guidelines are at. There's guidelines for businesses, for churches, for individuals, so a lot of really helpful information. I did have a face covering with me, but we practiced social distancing the entire time, and I think that's what we part of the recommendations from the Department of Public Health is that if you're outside, which we want people to get out, especially as the weather gets nice, to get some exercise and to get outdoors, but still to practice social distancing. And if you're in a situation where that's not possible, if you have a face covering with you, then to go ahead and put that on. But again, I trust Iowans. I trust them to do the right thing, and I believe they're going to continue to do that moving forward.
Right now we're going to go to Rachel at Channel 5.
Good morning, Governor. How did Iowa get on the short list for getting the first shipments of remdesivir?
Do you want to answer that? Do you know?
Good morning. Our understanding is that ASPR did some analysis based on current case counts, and they looked at areas of the country where case counts had increased over the last 7-day period from the time that they were looking at that. So I think our phone call with them was on Wednesday or Thursday of last week. And so they had identified case counts in one part of our state as increasing. And so that's our understanding of how they made the initial decisions about where those initial shipments were going to go.
We're going to go to Ron at KWWL.
Morning, Governor. I would like to ask you about far northeast Iowa, Alameda County. There's about 112 cases up there, believed to be coming out of the Postville area, which is home to the big Agristar plant there. So can you tell us what you know about the situation at Agristar and the possibility of testing in that particular area or at the plant?
So the reason you're seeing a tick up in the increase of positive cases is because we did one of the strike teams. We sent a strike team to Agristar, like we've done in many other of our manufacturing and processing facilities. And it really is twofold. It helps us provide some confidence to the employees to start to see the scope of the virus activity within the community and within the plant, identify those that are positive, identify those that are negative, separate the shifts, help the employees that have tested positive to begin a road to recovery, and then as they work through the timeline that they need to recover, then again, they feel they have the confidence to start to return back to work and to return in a safe environment, making sure that we're, providing them the PPE that they need and that the businesses are doing what they can on the inside of the facility to continue to practice social distancing, to continue to do the temperature scan before they enter the facility, to make sure that they're doing an assessment to see if they're experiencing any systems, to separate the breaks, the line that they work on to, as much as possible, provide the social distancing there as well. And so it's a combination of all of those. I think it was last week that we sent the strike team up there. I don't know the exact date, but Ron, I can have Pat follow up with you on that. But that is where we sent one of our strike teams. And again, I think the National Guard was very instrumental with some of their soldiers in helping us perform that strike team in Alameda County.
All right, Rod, go ahead.
Thank you, Governor. We're allowing schools to start before August 23rd. Should there be an Iowa State Fair this August? Other events like RAGBRAI have canceled, citing social distancing concerns. Do you plan to take any formal action halting county fairs and the Iowa State Fair for 2020, or will you leave that decision to them?
Well, it's too early, I think, to make that decision, and I know they're watching it very, very closely. And hopefully, if we can continue to see some of the positive signs that we're seeing, especially on the eastern side of the state, where we've done extensive strategic and targeted testing, where we've seen the numbers go up, but we've also seen them come back down. We're seeing the hospitalization trends start to go down. We've certainly been able to manage the resources so that we don't overwhelm the hospital systems. And so now we're doing that similar type of testing in central Iowa and western Iowa, and you can see over about a 7 to 14 day turnaround, you can see some significant changes, positive changes in the trends. And so we'll continue to monitor the information that we're receiving. We'll continue to look at the virus activity, have targeted responses to what we're seeing. And so, we're doing that on a daily and a weekly basis, and we're just learning more and more all the time. So I know they're watching it, and we're watching it. And as we continue to learn more, and we have the ability to continue to test more, those decisions will be made in the near future.
We're going to Dave Price, Channel 13.
Good morning, Governor. Can you tell us a little bit more about your daily testing regimen, what process, how long it takes to get results, what that whole experience is like?
Yep. So before even moving into a modified quarantine, every day when we would come into the SEOC, every person that enters would get their temperature taken and would be asked if they're exhibiting any symptoms. So now I will be taking not only my temperature with a thermometer in the morning throughout the day, and then again in the evening. In addition to that, on my way, before I even come to the SEOC, I will be tested. I was tested this morning. We get the results back in about 10 minutes. And of course, if they continue to be negative, then I will come to the SEOC. I will be wearing a mask. I don't have one on now because of the press conference, but when I leave, I've got a mask that I'll put back on, and we'll be practicing social distancing, and we'll really minimize my interactions with the team members that are out here. And I will be doing some work from home as well with Zoom calls and the ability to work from home. We're able to continue to do business and continue to serve Iowans in that capacity as well. So it'll be a combination of all of those, but we will continue to test every day before I even, come to the SEOC.
Caroline, go ahead.
Good morning, Governor. Sarah just mentioned that the case trends upticking over the past 7 days is kind of the basis for why Iowa qualified to get approval for the treatment drug, or remdesivir, if I'm saying that correctly.
Pretty good.
And so that being acknowledged, that cases are continuing to increase, what is your response to Iowans who want to know why we might be seeing more restrictions eased at the end of this week, like you teased earlier in this news conference, saying that you might let some of them expire?
Yep. Well, it's because of that very testing. We had the opportunity with Dr. Padati when we were at the White House to talk to Dr. Birx. She wasn't aware that we were doing extensive targeted testing in a lot of our manufacturing and processing facilities. And so they were very impressed with the testing, not only the diagnostic, but the serologic testing that we were doing as well, and especially with the case investigation and the contact tracing. She really commended us on our ability to do that as well. And so once we put it into context with what we had been doing in the state, she said, well, that explains some of the increase in the numbers that we were seeing, not only in the Des Moines area, but also in Northwest Iowa as well. And so, so we were able to explain that. That's what we were able to explain to Iowans, just like we saw at some of the facilities in the eastern side of the state. So you see a fairly high uptake of positive cases. What we're also seeing, and I'm anxious to get some more results from that, is with some trends and data from the serologic testing that we're doing, because so many Iowans have been asymptomatic, and that really helps us, I think, speak to the data that says that 80% of Iowans who test positive for COVID-19 have mild or little to no symptoms at all. It's the 20% older Iowans with underlying conditions that are at most risk, and that's really who we need to be focused on. And no matter what we do when we ease restrictions, our recommendation will continue to be to those vulnerable Iowans to continue to stay home, to limit your exposure. If you go out, to be very mindful about wearing face covering, but to really limit the amount of times that you leave the home until we can really start to see our numbers continue to trend down in a significant manner. So, it gave us an opportunity to explain what was going on. They didn't have the context of that when they were sending out the remdesivir, and so it brought more context to the situation.
All right, we're going to go to Natalie at IPR.
Hey, Governor, I wanted to just ask how many contact tracers you currently have working across the state, and then how many you think the state anticipates having total?
Good morning. So currently we have 150 members of the National Guard that are doing contact tracing and case investigation. And we've given counties the opportunity to turn over their case investigation to the state. So those National Guardsmen and women are doing case investigation and contact tracing for those counties who have asked the state to take on that responsibility for them. And in all of the other counties, they are staffing for contact tracing locally. And so my understanding is that many of those local public health agencies have also brought on additional staff members to do that work. In addition to the National Guardsmen and women doing contact tracing, we also have a team of epidemiologists at the State Health Department. And those individuals are doing follow-up phone calls with everybody who has been identified as a positive case to see how their recovery is going. And then finally, we also have a partnership with our Department of Human Services. And so those individuals, there are about between 20 and 30 of them, and they're helping us do case investigation and contact tracing on the positive serological cases that we're finding.
Thanks, Sarah.
We're going to try and get the two more. Nick, Des Moines Register.
Yeah, good morning, Governor. So if White House staff and officials are being exposed to this virus still, how can essential workers and people being recalled to work in some of these opening counties feel safe that they're not being exposed?
Well, we have to practice personal responsibility. The more that we're able to test, we're going to continue to open up tests across the state of Iowa with the Test Iowa and with the state hygienic lab testing that's available. We're going to continue to open up to give more Iowans the opportunity to see if they're testing positive or negative. We'll see what happens with the serologic testing as we continue to learn more about that as well. But the same recommendations apply that have from the very beginning of this. We could never guarantee that Iowans wouldn't get it. We know, again, that 80% of Iowans have mild to no symptoms. 20% are the ones that are the most significantly impacted by COVID-19, those with over the age of 65 underlying conditions, and those are the ones that really need to, stay at home and minimize travel outside of their home. So, we just always need to not lose sight of that. People need to, if you're sick, you need to stay home. If you're exhibiting any of the symptoms, you can certainly call your physician or your clinician and run through the symptoms that you're experiencing, and they will make the decision if you need to get tested or not. You can go online to testiowa.com. You can fill out the assessment there and see if you qualify for a test as well. So we've got more and more test sites all across the state, so we're doing everything we can to bring those opportunities to Iowans. I think employers, if you can work from home, they're going to should continue to allow you to do that if it's possible, and make accommodations for employees as they return back to work.
Last question, Ryan Foley, Associated Press.
Thank you. Last week you spoke of Iowa having the capacity to test 5,000 people per day. When do you think the state will be able to hit that mark?
Well, we've done really good the last couple of weeks. I think we were almost at, was it 3 or 4? 3,100 last week. So, we're really close to getting Test Iowa validated. So that will be a significant piece in us allowing us to continue to ramp up our numbers. And I think as we continue to stand up Test Iowa sites and do some of the strike teams, you're going to continue to see those numbers increase. But the State Hygienic Lab has been doing yeoman's work in really managing the number of tests that we're sending to them, and we're going to continue to see those numbers ramp up so that we'll hit that number that we've been highlighting that we should be able to do. So I just want to give just really heartfelt thanks to what they're doing at the State Hygienic Lab. They're working round the clock so that Iowans can get the results in a timely manner, and I really appreciate that a lot.
Thanks, everyone.
Thank you.